If I told you that there was a treatment that could be used to eliminate fine lines and wrinkles, your first guess would undoubtedly be Botox. But what if I told you that the same treatment could also be used to treat chronic migraines, overactive bladder syndrome, and excessive underarm sweating? I would bet you're not thinking the answer is still Botox, but it is. Botox is becoming a more and more popular procedure to treat a variety of health ailments. As I mentioned, Botox is being used in the treatment of chronic migraines. Migraines typically come from stress, and once those muscles can relax, the migraines lessen or disappear completely. Botox is a toxin that relaxes muscles in the body in very, very small amounts. In February of 2019, the Mayo Clinic came out with a study stating that if you are suffering migraines or severe headaches 15 days out of the month or more, Botox may actually help to reduce the frequency and severity. But how? How does a cosmetic drug help treat migraines? So, Botox helps treat migraines because it releases the tensing, pulsating muscles of the face, which is what causes the migraines. It blocks them. So, helping to treat the underlying cause of chronic migraines is only one of the medically beneficial uses of Botox. It's no longer just an elective cosmetic procedure. It is being proven by the FDA to effectively change lives and is helping migraine patients suffer far, far less. In addition to migraines, Botox is also being used to treat overactive bladder syndrome. The ingredients used in combating migraines is the exact same ingredient that is used in aiding overactive bladder patients and helping them to regain control. Medical News Today published an article after holding an interview in just February of this year, explaining that manufacturers have been able to administer Botox injections in very small doses, and they can disperse the active ingredient, which in Botox, that active ingredient is called botulinum toxin, and that ingredient is what temporarily paralyzes the bladder muscles. This benefits a whole range of muscles and nerve-related disorders in patients by helping them to regain control of a part of their body that was hindering them in so many ways and preventing them from leading what you and I would consider a normal day-to-day lifestyle. We take for granted the things that these people don't really get to do or experience in a normal day. We don't have to leave early to make sure that we're able to run to a restroom in time. We don't have to excuse ourselves on a regular basis from public settings. We don't have to miss out on important moments of our day or our lives or our family's lives due to overactive bladder syndrome. So it's a huge step for these people. Another unknown use of Botox is that it helps to provide in relieving excessive underarm sweating. So living in Florida, we can all admit that everybody here sweats. And while it isn't technically a polite or a very common topic to discuss among friends and family, it is a common problem and it affects men and women alike. Whether you're young, middle-aged, or a little bit older, everybody here is going to sweat. It's just part of the Florida life. So just like migraines and overactive bladder treatments, the same botulinum toxin ingredient is what is delivering the help here as well. Aside from cosmetic procedures, using Botox to decrease the amount of underarm sweating is probably the second most popular use of the chemical, as well as the second most researched here in the US. In January of 2019, last year, the mentalhealth.org website ran a story explaining how the same concoction that can smooth your forehead can have such an impact on eliminating excessive sweat. So they went into detail describing how Botox injections block the nerve signals responsible for sweating, which then stops the sweat glands from producing too much sweat. The only downside is that retreatment is typically needed for this every 4 to 6 months because the nerves in the underarms regenerate. Some research has shown that over time patients are able to go longer between treatments, but while they have shown a substantial upward trend in responding positively to the Botox treatments in regard to the excessive underarm sweating, the discomfort that the patients say that they are associating with multiple injections every several months is very deterring. It is much more painful to have the injections administered in parts of the body that host more nerve endings than others. So while having a cosmetic procedure for your face, for fine lines and wrinkles, there's not as many nerve endings, so it's not as uncomfortable. But in your hands, feet, or in this case, your underarms, the nerves are much more sensitive, so the procedure is a lot more painful, and a lot of times people do not want to go back and have it done, even though their results are positive. Botox, in conclusion, is no longer used only for cosmetic purposes, and although thousands of patients run to have elective procedures done to reduce the look of fine lines and wrinkles, Botox has become a very steady and reliable method of aiding, and it's even credited with curing certain medical issues where the nervous system plays a part thanks to its nerve blocking abilities, such as the migraine relief, suffering overactive bladder syndrome, and aiding in excessive underarm sweating. The method is wildly successful when utilized by a physician in a doctor's office and no longer is holding on to its claim to fame simply by making people look younger. Now it's actually helping them feel like they're younger by keeping their brain healthy, their bladders controlled, and keeping their sweating at bay. Hollywood may be what put Botox on the public's radar, but all of these additional benefits are what will make a positive, lasting impact on the everyday citizen's life in a much, much bigger way. And there's even more procedures on the horizon coming to help these patients.